everyone, this is Judy. Today's date is Wednesday, September 29th, 2010. This video is mainly for people out there who have not had their lap band surgery yet. For the people who are still seeking a surgeon, this also is for you. What I want to say is, when you're selecting a surgeon, there are a few questions you most definitely need to ask. And I neglected to ask them, and I'm paying the price for it now. The first question you would want to ask your surgeon to be, or one of the questions you should ask, is what do you routinely give the lap band patient on the first initial fill? How many cc's do you give for the first fill? And your next question after that would be, what is your routine for the subsequent fills? For all the fills thereafter, how many cc's do you give after that first initial fill? Another question you might ask is, if I, the patient, feel that I need a larger fill than what you normally give, will you give it to me? If it's a reasonable amount. I neglected to ask my surgeon those questions. And like I said, I'm paying the price for it now. I am in the process of trying to find another surgeon who would give me my fills. But I'm telling you right now, it's an unwritten rule among surgeons that they will not take another surgeon's patients. If you recall, Melanie, aka Sky Moon 1982, she had a very similar problem with her tummy tuck. She had it done out of the country and was having problems with it, and she went to surgeons and no one would touch her. It wasn't until it was life-threatening that a surgeon decided to do a revision of her tummy tuck. It was not literally, verbally confirmed to me about this. I called another surgeon today, and his nurse called me back, and I explained to them I was very disappointed in my surgeon that I have now. He doesn't really listen to me or take into consideration my thoughts about it. I said, and I would like to find another surgeon who would do my fills for me. And she basically confirmed what I suspected, was that surgeons normally don't take on other surgeons' patients. She said what he will do is he will see me and he will give me a fill. But what he does is he calls it a program fee, and he will charge the insurance company $500 for this program fee. If insurance does not pay for it, he will cut that in half, and I will have to pay $250 out of pocket for this fill. I'm not very happy about that, but I definitely do not want to go back to see my original surgeon. Many of you have known that if you subscribe to me, which I have not made videos in quite a while, only because there's nothing really to report. I am 11 months post-op. Original weight, high, was 242 pounds. The day of surgery, I was 229 pounds. Today, I am at 207, almost a year out, with a total of 22 pounds gone since surgery. I find that unacceptable. I know many of you are probably thinking, oh, well, she's doing something wrong. And mind you, when I was pre-lap band, and I went to a couple of those support group things that you have to go to, you know, before you get banded. You have to attend at least one session. Blah, blah, blah. I ran across a patient of the doctor that I have, and she was over a year out. Maybe she was like a year and a half or something like that. And she said she'd lost like 30, 35 pounds. And I thought to myself, damn, you're doing something wrong. But knowing now what I do, it's not her fault. My doctor, my surgeon, the original fill, he will give 1 cc. Any fill that thereafter, he gives 0.5 cc's. I have had 7 fills so far. I am now up to 4.5 cc's. The last time I saw him was July 19th. He was very, very disappointed in me. I think is the right words I want to use, because I had seen him before that was sometime in May. It was like 6 weeks before my July 19th, so it was in May sometime. And from May until I seen him in July, I had gained 4 pounds. He wanted to know, why aren't we losing weight? I looked him straight in the eye and I said, that's what I want to know. Why aren't I losing weight? So he began to quiz me on what I was eating. And I explained to him what I was eating. He said, well, it sounds like you're eating okay. It's just that you're eating too much. I wanted to get sarcastic with him and go, duh, I want a bigger fill. But he ended up giving me a 0.75 instead of a 0.5, which then brought me up to what I am now at 4.5 cc's. I might add, in the beginning, that felt pretty good. I was doing very well. I was eating maybe 900 to 1,000 calories a day, slowly losing the weight. So I went from 216 when I had seen him in July, and I'm now at 207. But I am in desperate need of a fill, and I don't want to see him again. I am tired of this. It's been almost a year. I should have been in Wonderland already. I am nowhere near where I thought I would be. I'm very disappointed. I am not disappointed in the lap band. I am disappointed in my surgeon. He refuses to listen to me. I tell him I don't feel anything. Can I have a bigger fill? No. And his threatening words are always, if I give you a bigger fill and something gets stuck, we have to do a complete unfill and we will start all over again. And who in the heck wants to start all over again? So my advice to you people out there who are not banded yet, please ask those important questions, because once you're banded, you are going to be married to your surgeon for life, and it will cost you dearly if you want to go somewhere else. I'm sure if I moved out of state, that probably wouldn't be an issue, but since that's not the case, I'm going to pay for it dearly. So that's just to let you know. And I have been doing video diaries, but I keep those to myself. It's been a very disappointing run. So everybody out there, hope you're doing well. Take care. Catch you next time. Bye.